Training the dogs is one thing, but training the people, that's really where it is, because now they can be better to their dogs. Their dogs can trust them more, and they're going to be more successful. And I've done a lot of coaching of people at nationals, and it's really what turns me on, is putting together the dog-handler combination and helping them understand each other. And well, success is bound to happen when you can do that. This is our 2025 Purina MasterClass kickoff. We're going to have a good one tonight, I'll tell you. First of all, well, I want to thank Purina, the folks at ProPlan, Carl Gunzer, Ray Vogt, and everybody else that makes this possible. Such a great, well, educational platform for me and for you, and we're going to have some great guests, and we're going to kick it off with a bang here tonight. Our guest this evening, let me tell you a little bit about tonight's guest up. Well, long-time friend of myself. I met Dr. Sarah Shull. Well, I was looking here a little bit ago, and I'm going to ask her about that national that she traveled to with the Spree Kennels to Ardmore, Oklahoma. I think that was the first national championship she'd been to. And well, I think it set the hook in Sarah. But she's going to be awesome. She's got a great presentation tonight. We're going to talk about decoding health clearances. So I guess without any further ado, I'm going to welcome Dr. Shull. Hi, Sarah.
Hey, Pat.
Thanks for being here.
I don't remember everything about that national, but prize won it.
2000. I just looked it up. I had to get the
Ardmore,
facts right.
30
Ardmore,
degrees
Oklahoma.
in Ardmore, Oklahoma. We were all frozen to death. I guess I can officially consider her the first field trial retriever that I've actually had from minute one. Of course, you never do it alone, but as far as she hasn't been sent away to a trainer at least. And so we had quite a derby career, and she took me a lot of places. She just turned 3, so we've thankfully been done with that for about a year, but we had a really good time. So that would have been in Texas. She was a baby dog, showing up in Texas, which is not the easiest thing to do always. So have a good time.
Well, tell us about tonight. Here you go. Here's our intro. Perfect segue.
So I love this. I love this topic. I love having conversations and chats about dogs with Pat. And really it all comes back to, this isn't one of those stuffy intros. You don't need to know all the places I've worked or all the things I've done. Basically what it comes down to is I'm one of you, everybody that's on this call. And so I've been president of breed clubs, not even major breed clubs, some small breeds like you see in the left-hand corner here. So I know, I've stepped off of boards, I've been kicked off of boards and breed clubs, all those kind of things. And so I know all the things that go into some of these decisions and terrain that you're navigating as we talk about health clearances. I have been fortunate to have experience with a variety of breeds in dog sports, dog shows, agility, obedience, either through my clients or my own personal experience. I'll always have a wire hair pointer as well as my retrievers at all times. So I certainly have played a lot of the games. I do have degrees in such things and student loans to prove it. So I do, I have done some of these things officially as it relates to health clearances. Never will say I know it all, and I continuously learn a lot from all of you, especially with many of you that have been in your breeds for a lot of years. Before I've even been a vet, you've been breeding your breed and evolving your breed along the way. I've known Pat for half of my life, which is not half of his, just to point that out. So always an adventure there. And then I'm going to bring up OFA a lot, but certainly don't get paid by them, but it can be a great resource. So I'm going to plug them a whole bunch to this whole talk, but it's not because I'm on their payroll. And speaking of money, currently my biggest sport is field trial retrievers, as we've alluded to a little bit. So All my money and time currently revolves around such things when I'm not working, and I actively do work. Sports medicine rehab is my specialty, mainly dogs, some cats, some everything else, and at Michigan State in East Lansing.
Sarah, do you know who was kind of responsible for the beginning of OFA?
John Olin
Ah,
in 66 or so. I mean, I actually did just look up that factoid not that long ago.
well, you nailed it. I thought I was going to stump you, but yeah, I got to go to Nilo Kennels on a field trip and see the home of King Buck, and I did not realize that John Olin was so instrumental in starting OFA. But John Olin from the Winchester Corporation, Winchester family, great story.
Random fun fact that I didn't even know that I knew until you asked it. And so, what we're gonna spearhead this evening is to talk about health clearances, and what I how I want to structure it is basically, who does this apply to? All of you on this call, but just the big picture of, we're talking about health clearances, who cares about those, why to do them, what to even do as we start to jump into this topic, when to do them, what ages and decision-making points, who can do them as far as if it needs a specialist or a general practitioner yourself, and then where to go to learn more, because we're not going to cover every single thing this evening. And even if we did cover every single test that was available for every single breed this evening, it may change tomorrow, and that's not a bad thing. And so we're going to help you out with some where to learn more, and we're only going to scratch the surface tonight. We have lots to do in this next time. We want to leave some time for questions as well. But know that I'm given the overall big picture, and we'll wrap it up with some resources so you can learn more, delve in more, or see how things change over time. So I thought the first one I'd jump into, we'd talk about the who and why. So who does this apply to? And Pat, certainly you may have a different perspective as well, but for me, this is typically going to be thinking about purebred dogs with registration numbers and permanent ID, but that doesn't mean it can't apply to others. Most of the time, we're trying to get a baseline is a lot of our why. We're trying not to wait till those animals have the condition and then play catch up. Many of these health clearances were identifying some issues a lot earlier than we could if we waited till they were affected with these diseases. We oftentimes, the obvious is breeding animals, but there's also all the siblings and offspring of these breeding animals, which we'll touch on as far as I think we can do a better job of that in this country. And if you're not necessarily breeding animals or involved in the breeding of different breeds, still being educated about health clearances help you select your next puppy or dog. And by being educated, that doesn't mean making sure that every single health clearance is done to a certain level. It's just being educated about what they each mean and what the pros and cons might be. And so really it's everyone involved in dogs, in my regard, to just know about health clearances and to delve in a little deeper. No, my biggest point is just for everybody, and I'm sure everybody knows this as well, but a good reminder for all of us is that it's not just about breeding animals. It's health clearances and the pros and knowing about the pros and cons of them, not even just doing the tests, but the actual full big picture of when we're looking at animals genetically, that it's not just for dogs that are being bred. Go ahead, Pat.
Well, what I wanted to say is I'm thinking back in my career when I was in the early 1980s, and there's only two things I thought of when health clearances came up were OFA for hips
Mm-hmm.
and eye issues.
Yep.
And PRA and other eye things. That's really the only two things we thought about back then. And I don't know if I was just ignorant about it or that was really the beginning of tracking these clearances. Can you shed some light on that for me?
Absolutely. And you might not have been aware of necessarily what all you were doing as far as thinking about them really as health clearances, but you were doing yearly blood panels, you were doing all the tick-borne diseases, you were doing a lot of things. And in, the late 90s, early 2000s, there might not have been a test for some of these diseases, but you were still screening in the top of your game in that entire kennel, thanks to yourselves and your owners and handlers and trainers as well. And so you might not have known how much health clearances you were really doing at the time, but you always were one of the proactive kennels in doing such things. And
Thank you.
the first tests that I'm going to talk about are the ones that really apply to the largest number of breeds and people, and historically some of the things we've always prioritized. But I will talk and touch on, after we talk about some specific ones, kind of the prioritization of testing in general, as far as maybe sometimes hips and elbows, maybe those weren't the above all end all things that we should have made every decision on either. And so it's just a mindset and a thought process versus always being black and white on that. So I was going to delve into hips first, because like you mentioned, that's a pretty common one. It's been common historically. It's been common across many breeds. And so really, when you're talking about and throwing around hip OFA into this world, we're talking about a very specifically positioned X-ray. And all of these images that you'll see through these presentations are my dogs, whether they're the pictures or the X-rays here. And so nothing I'm ashamed of, even if they did not clear. But these ones certainly did. And so you're looking at very specific positioning. They are specifically looking at how those hips fit together. The secondary changes, we throw that term around a lot in some of our testing. That is really what the body thinks of how they fit together. So even if we visually think that it all fits together great in a two-dimensional image, if the body's saying no, it doesn't, it's moving around a lot, it may form some arthritis and some bony changes that we're picking up on those x-rays. And so that's why we're waiting till these dogs are 2 years old to do these rads typically, because we're waiting to not only use our judgment, but the body's judgment as well. And you'll see that come around in the elbows as well. And so when you get back your hip OFA certification, you're typically going to get it to come back as either a normal, which is excellent, good, and fair, your borderline, which hard to make a call there, and then dysplastic. So that's your mild, moderate, severe as far as dysplasia. And there's a ton of urban legends out there and some pretty big emotional conversations about, did they have a bad day, or did they already give enough excellence out that? And I'm sure there's some of that might go into day to day. Everybody's human, but the scoring system is done. It is grading, averaged over 3 board certified radiologists that have went through at least 10 years of training to do such things. So at least we have that to fall on, but certainly not infallible any time of the day. So I wanted to just point out that you can learn a lot even just from the number. So here's a hip certification number of one of my dogs, and the G in the middle of that means it's good and that it was done at 24 months, and then VPI is vet permanent identification. So even as you look at these numbers, even if you didn't have access to the actual certification, there's some decoding of the actual number you can do as well.
So Sarah, I can remember that was the tensest time waiting for the mailbox to see that OFA, letter come in the mail. And I mean, it was scary. And
Yes.
am I correct in saying, I mean, it's one of the most successful examples of controlling, or not eliminating, but dramatically reducing a condition? Because I rarely hear of dogs with bad hips anymore. And there was a time where it felt 50% or better had bad hips.
We're certainly at numbers that show we've done it a lot in a lot of breeds. Certainly there's some pros and cons, and we'll touch on how maybe there's still some areas of improvement in all of these tests. But the sheer numbers of how many have been submitted and just the decades that we've been doing it helps this test tremendously. So if we would have this much data on all these tests, we could do a lot of things with it. And there's some ways we can even improve even beyond what we have done. The hard part is it's hard to really track numbers and really call a test successful or not over time, because the more submissions are going to alter the number of percentage positive or negative. And as we'll talk about in the limitations, is that there's no requirement to send goods or bads in. And so it may look like we've improved in a breed, but the bad ones that we're taking, we might not even be sending in the first place. And so until we get into a system where all are actually submitted and they're all looked at, it's really hard to say absolutely this test improved the incidence of this disease, whatever test we're talking about. And so it's still so much by choice. You don't really get a full representation, but like you said, I mean, experience is such that it certainly couldn't have hurt.
So
And yeah, go ahead.
my whole experience is just in, you know, seeing dogs, talking to owners, and just so rarely hearing of a dysplastic dog in the world of not just field trial retrievers, but hunt test and all that. It seems like it is not very common when it used to be, you know, very significant.
And I think the more and more competitive a lot of our sports get, especially when you get into the athletic sports, the form follows function. And so it's not just the testing that has allowed these to improve. It's the fact that our hunt tests, even our field trials and spaniels, retrievers, pointers, everything, even the sight hounds doing coursing. I mean, we keep going to more and more extremes of our sports in a lot of venues. And so those dysplastic dogs aren't showing up at the top quite as much as well, would be another theory that I'd put out there. And
Okay, that's
yay, we're doing testing. I don't want to diminish the fact that yes, I think I don't just think, I mean, certainly the OFA testing has helped every breed in some ways, but I certainly don't want to say that that's the only data as a black and white option. And I'll show you there's some great reports through OFA for all of these testing as well. So you can track your breed, you can track it over time, you can really put some teeth into these, but you do have to remember that all of the tests are not submitted. So you're never going to have 100% transparency with normals versus abnormals. And we go through trends, right? Where like a popular sire might, you know, have this and then all this goes on. And so then everybody tests or not tests. And so we also trend just from a social type of situation in breeds as well. So, the as kind of we've touched on some of these, most of the time we're talking about OFA hips, their final certification. That's going to be that 2-year-old time. You're waiting for their 2-year-old birthday, quick doing the X-ray. Luckily now, Pat, it's electronic, and so the vet clinics are sending them in. You might get those back in a week to 2 versus the 3 to 4
oh
to
wow.
6 weeks before, which was extremely, like you said. I mean, I could even on my own dogs take X-rays that looked as good as that one on the last slide that I knew it was going to pass, like no question about it was going to pass. And even I hold my breath when I open that envelope. So, but now it comes by email and it's a lot faster turnaround. And so the good news about OFA is it really is just an X-ray. So that's something that many practitioners can do if they choose to all across the country, doesn't require specialized equipment or training. Typically, it's just done the one time in their life. So it's not something you're doing annually, like some of the tests. And then it is a public database. So you can search for different progeny and siblings and all that kind of stuff within their database. Limitations are it doesn't really look at the laxity or looseness of the hip joint in the socket, which can be a player with some of our dogs. It's just looking at the conformation and that one snapshot in time. Certainly some injuries can affect OFA ratings, and that can be unfortunate for some dogs as well. You might have to wait until 2 years old. And by 2 years old, especially this day and age, right? They're already aged out of their derby. They've already had one career in some of our pointing and retrieving breeds. And, our working dogs, we're having a lot of time, effort, money and training and invested in these dogs. So 2 years old can be a long time to start over if you're dealing with dysplasia in a breeding program or in a working dog situation. And so the limitations, like we already touched on, is that not all are sent in and only abnormals are released if you actually say it. And I'll show you the spot on the forms here in a little bit. Transitioning into elbows, sorry, I wanted to give PennHip their shout out as well, since we talk so much about OFA. That does test hip laxity. And so you're looking at how tight or how loose the hips move within the socket. And so they're scored or measured within 3 different images or positions, and they give you a distraction index. And so you're going for a lower number typically, and the dogs in the tighter half of the breed population are what is considered to be breedable. And so typically we're saying that's around a 0.3-ish, but it's really a sliding scale depending on your breed. And so you're rating that between a 0 and a 1. So you're not getting what's dysplastic, what's not. You're saying lax and tight, basically. And so those you can do as early as 16 weeks and just do them at the one point in their life if you choose to. And that's predictable then at 2. There's been studies to follow these dogs up. And so if you really had to make a decision about a dog, a police department with a shepherd or a Malinois, whatnot, why not know this? Now, that might not mean that they don't keep the dog, because hips aren't the above all end all either, and as we'll touch on a little bit later. So obviously the strengths, you can do it earlier in life. You're comparing as apples to apples as much as you possibly can. Everything is sent in, so it's not like OFA where they're bad and you don't send them in, and it's as objective as possible. So it's a measurement versus the 3 people getting together to rate them. It does require some specialized training and equipment people go through to be trained. That's become easier and easier and easier over time. So more veterinarians are PennHip certified. The downside of it is it's not as public of a database. So I can't look up the distraction index of my dog's brother to follow that through, whereas OFA ratings you can. I hesitate to put sedation as a limitation on either one of these, because many of the OFA images are done with sedation as well. And with the advances in sedatives and such, the safety of those have increased so much that I hate to really even put that as a limitation of either one of these. And so I put that on there. I know that's different for different breeds and past experiences and personal feelings, but for me, very much sedation is not a limitation for OFA or PennHip. And in my perfect world, and if I was running a full-time breeding situation with any breed, I really consider using 2 of them together as I went through generations. I'm going to transition into elbows, Pat, unless you have any other questions about hips or thoughts about hips.
No, I actually, somebody asked about the sedation, so you covered that perfectly.
Yeah, it's interesting. We've evolved with that, and there's a lot of conversations. I just had a conversation this week about that, and like I said, we're all a collection of our past experiences about OFA ratings, and they're better if you don't sedate, or they're worse if you do. I mean, everyone's had their experiences where it's been a bad experiences or good experience, and we are a collection, and there's very few studies that somebody can stand in front of you and say that you're right or wrong or whatnot. And so recognizing that your past experiences were right too, I'm certainly comfortable anymore just sedating my dogs with the level of sedation that we have. This isn't full anesthesia with most of these radiographs. It's just a light sedation. They're asleep enough, quick, take the picture, reverse them, be done with it, take good quality images the first time and go on. Now, certainly, like I said, everyone has different opinions on that. That's just what I do with my own guys anymore. It's less stressful for them. It's less stressful for me. Some of these images we can even take with us not even in the room, so less radiation for humans. I'd like to keep as many people in my profession as absolutely possible long term, so less radiation the better for us as well. Elbows, a lot of the same messages as hips. We do a flex lateral elbow, which is laying on the side, which you see here on the screen. Same thing, we're looking to see how they fit together and how the body thinks about how they fit together as well. We're looking for arthritis and inflammation. With this, you're just getting normal or grade 1, 2, or 3. And so when we talk about elbow dysplasia, that's not one disease. That's 4 to 6 different diseases, depending on who you're talking to, that make up the elbow, because there's 3 different bones that make up the elbow and everything has to fit just so. So when we talk about elbow dysplasia, it's a much more complex low specification joint compared to the hips that it's just ball and socket, and there's a lot of potential there. And so the wens and the strength limitations extremely similar to the hips. We're doing those finally at 2 years, but can do them earlier if you so choose, if you just want to take a sneak peek at those. We're just looking at a radiograph that most people can take one time in life. You don't have to sedate, certainly an easier view to get with their laying on their side, and a quick view like this versus on their back with their hips out behind them. Limitations, you can't see all parts of the elbow. So if you really were digging in for an elbow disease, then you're going to do a CT scan to see every single part versus a two-dimensional view. Injuries can affect. It's really hard to decide what to do about those grade 1 elbows. Was it an injury? Was there any, problems in growth? It's hard, right? And so it's a lot of other things to make decisions on. And so once again, limitations 2 years, and it's only as good as the information we share. So I was going to transition to
let me say one thing. I mean, am I correct when I say that in my opinion, elbow problems have caused more issues in field dogs than hips, as far as just being able to function?
Yeah, not even, you're not, I mean, it can be your opinion, it can be any, I mean, that is hands down a worse disease. Elbow dysplasia, even the littlest amount of elbow dysplasia can be clinically significant for those animals, where they can have horrible hips and sometimes not limp a day in their life. A dog naturally carries 60% of their weight on their front end versus 40% of their rear, just standing there. And then you take in, now they're retrieving, I'm gonna be a little retriever centric this evening, but you think about the braking forces, the quick turns, the stop and retrieve back to you, all of those things, that front end is taking it every day of the week. And so, and those three bones sitting together in the elbow, really tight joint. So little teeny pathology, little teeny things in there create some huge limps. Plus, I can't fix them. And so hips, I can replace those, like no big deal. So 40% of the dog, only propulsive forces and some pushing off and maybe a little bit of turning in the back. Elbows, lots of forces, less things I can do with it. And so I can replace hips, obviously not without any issue, right? Like it's still a big deal. Elbows, we can. I think we've done 10 at Michigan State in the history of elbow replacement. So where, there's some months we might do 10 hips a month. And so yes, elbows can be replaced, but that they would not be workable again in the future. So there's also that it's a worse disease and I can't fix it. And so as we talk about prioritizing all these tests, all these conditions, all these grades, what does it do to the animal or us and such? And I'll delve into that a little more broad brush a little bit later. So hips, elbows, and then eyes. Like you mentioned, that's another one that you remember quite a bit back in the day as well, as the primary thing. And so very similar to previous, we only changed some names on these tests. And so what the eye certification is the eye screening exam. So someone looking in the eyes. Most of that's going to be after pupil dilation, so they can really see all the angles and corners and depth in there. There's a couple breeds that require looking at that before dilation as well, but that's all listed on the OFA site, and that with your breed if you need to be. We used to call it surf. It was always surf, and we still sometimes call it that. But technically, that transition away from the surf registry happened in about 2012 to 2014. And now this companion animal eye registry is now what it is. And so that is now incorporated, embedded with OFA. So those are listed and tabulated within the OFA realm versus the SURF organization was a separate entity. And so these are tests that are performed by board certified veterinary ophthalmologists. You're doing these. I actually had to look this up because I couldn't think of when you might do this, but you actually can do it as soon as their eyes open, but most people wait till they're about 8 weeks. Most common, if you're going to do them as puppies, it's going to be the 8-week time, and then you'd have an annual recertification throughout their lifetime. big strength, all the data is collected and shared. So you can actually look up these blue book compilations of data that are kind of fun to go through. Very painless to the dog as far as you're just looking in the eyes, which can be weird for some dogs and some breeds, but in most cases it's very easy. You can be, looking in eyes is good for them and us, and so you can be alerted to findings about health. And these are pretty accessible, many dog events all across the country. And so the limitations is you can find out a bunch of stuff, and not every finding that you're going to find is truly something that is genetic or hereditary or may never even turn into anything else. And so you may have findings the more you look. We get a lot of like, here's an extra eyelash, here's even some cataracts, and not all findings of abnormalities that are noted on the form are actually something that we're worried about at all, but it's hard to digest which things to worry about and which things not. And so the other limitation is this isn't where you'd go if your dog is actually having eye problems. This is something that they're just screening for tests, but they might pick up on some things to say, hey, you need to look into this deeper. A little bit of a limitation is eyes change, just like all of ours had, right? Like I should be wearing my glasses, but I don't know where they are. And so you do need to do them. I really don't. I just got them like a month ago and I'm supposed to wear them every day and I really don't know where they are. And you need a specialized veterinarian. And so that can make accessibility hard as well. Any thoughts about
let me
eyes?
just say
Yeah.
something real quick. I just want to remind everybody to put your questions in the Q&A box. I see some coming in on chat. We're going to end up losing those. And when we're done with the presentation, we will get to your questions, as many as we can get to. And so be a little patient on that. Make sure you put them in the Q&A box so we can chase them down and address them when it's time. All right. Sorry to interrupt you, Sarah. Go ahead.
And I think that some form of this presentation is going to be released into the world as well. So if people have things that I have on the slide that they don't want to write down and such, we'll have the recording. And also I think that the actual words in a PDF might get released into the world as well. So if that's helpful to anybody. So hips, elbows, eyes, hearts. So hearts get even a little more confusing, and we made a couple changes in this realm over the years. And so in generally what we're looking for in cardiac clearances, we're trying to detect and describe any heart murmurs. And heart murmurs are just noise of turbulent blood flow. That can be from narrow areas, which we usually call stenosis. Areas can be too open. So there's a hole, there's a defect, there's something like that. Or the valves within the heart either don't close all the way or don't open all the way. And we get that turbulence like water in a hose with your finger over the end. And so that's what we're looking for visually with some of our tests. That's what we're hearing for with some of our tests. And I just included a little bit of what a murmur description would look like on the actual application form. And so this is where it gets a little more confusing. And this is something that as you delve into this, it's going to be very breed specific, and the diseases that are important for your breed, your sport, your past experiences with maybe what you've lost a last dog to, or, just a lot that goes into this. And so in general, big picture, we have a basic cardiac database and we have an advanced cardiac database now. And so a basic cardiac database, all vets can submit there, can do the test to get the certification. But on the certification number, just like I showed you the hip certification number, at the end, it's going to say either C for cardiologist, C for specialist, which would be like an internal medicine specialist, orthopedic specialist, it's not a cardiologist, or P for practitioner. And I'm not saying that one's necessarily better than the other, but I kind of am, right? So like if your whole specialty is cardiology and you have the opportunity to have a cardiologist listen to the dog's heart and certify him, I'm going to go with that. That doesn't mean a general practitioner vet doing it isn't still way, way better than not doing it, but I do tend towards cardiologists as a personal preference. That's going to be the listening to the heart. So done in a lot of health clinics all over at dog events, and very simple test. Then the advanced cardiac database, that's going to need to be done by a veterinary cardiology specialist. Typically, that's going to always now be an echocardiogram. So that's going to be looking at the heart by ultrasound, looking at the valves, the chambers, everything as far as all the things that I mentioned, as far as narrow areas and open areas and valves and such. And then we're going to be watching that flow through Doppler. And so with those, we're looking at both congenital heart disease, like is there a hole? Is there something that's abnormal congenitally just from birth? And those clearances for those disease are permanent. You get those and your dog is clear of that. Versus the adult onset or developmental cardiac diseases like the dilated cardiomyopathy of the Dobermans, that's something those dogs need to be tested annually. That's not something you can test them one time in their life for and never look at it again. We all know that, just like eyes, right? Like our own hearts change year to year, and your heart concerns when you're, the active high school basketball player and they have a heart issue, that's different than your grandmother, right? And so you do need to test these over time if the diseases that you're worried about are more of the developmental ones. And then some breeds also have to have electrical monitoring with this testing as well. So this is kind of like the Pinto versus the Cadillac as far as some of these tests. I wasn't going to say Maverick because that's my thing, and I think they're Cadillacs, but so we'll pick on the Pinto. So so cardiac, we can do that test as early as 8 weeks old. And so before puppies go to their new homes, typically that's going to be auscultation. And then if we pick up on a murmur, we might choose to do an echocardiogram at some point later on. Not many echoes are done on 8-week-old puppies unless we detect quite an issue, but they need to be 12 months old before they receive their actual clearance or health certification. Obvious strength, if we can prevent a fatal disease, a drop dead at 2 years old, we certainly want to do that for the dog's sake, for our sake, for everybody involved's sake, or maybe just delay the onset of symptoms, pick it up before they are in heart failure. So this is an example of something that's a valuable thing for the individual. This isn't all about you doing this health clearance to decide if this dog's going to be bred. This is, why don't we do this heart clearance so we can see if this dog's going to drop dead or have a life-limiting event that I should know about sooner than later. And so the downside, just like eyes, not all findings are big genetic considerations. So sometimes you might need to retest later on. It's not as one snapshot in time like a hip or an elbow or PennHip clearance would be. And we do need a specialized veterinarian for this. Are we ready to delve into genetic tests?
Scary.
So we got hips, elbows, eyes, heart so far. So now we've got everything else. And so hips, elbows, eyes, heart, those are just the meat and potatoes that we all can throw around. Pretty straightforward, lots of resources on decision-making with those tests. And then we get into genetic tests that change by the day. And so when Pat and I were doing research in our backyard in 2000, we were exercise-induced collapse hadn't even been named yet. Like we knew there was a disease and they fell over, and we knew it was genetic because we could label in the pedigrees and 3 generations of this, and there was no treatment and there was no, necessarily diagnostic test we could do, which I had just graduated from vet school in 99. And there's nothing more that will just tick off a young veterinarian as they get out and here's this disease that the dogs fall over. There's nothing you can actually do and then they just get up and walk off typically, which just blows your mind that they look so bad and then they look so good. And I can't just send in a test for it. Well, we've come a long way, right? I mean, that was just, 2000, and here we are in 2025, and that's an easy genetic test. I mean, I can send off dew claws in puppies for EIC and have the results back and make my decisions, maybe which ones stay in a breeding program and things like that. And so EIC, easy, but 25 years ago, we didn't even have a test for it. So these are things that in every breed can tell one of these stories where there's diseases that pop up when they're looking for them. Now, that being said, breed and individuals can totally overreact about these tests as well. And so you have to be really careful. Like back in the day when EIC came on the market, people were thinking about, not even going on. I mean, culling carriers, and like they were discounting carriers, and like it was like this horrible thing. Like an EIC carrier was like this evil thing. And it's like, well, actually, no, like please don't get rid of everything that might be carrying that, because they're not going to actually have the disease unless you breed them with another carrier that go on to make affected. So please don't overreact. The more genetic tests that we have, I mean, some of them have been a blessing in breeds that we can clear some stuff, but the tendency is to just keep testing more and more and more and more and more, and freaking ourselves right out. And so genetic tests, I'm not going to go deep into each one tonight, because this could be hours and hours and hours of very breed specific discussions. But in general, this is something you're looking at DNA. So you're looking at blood, cheek swabs, dew claws, depending on the test. You'll see this thrown around about this cleared by parentage thing. So if two dogs were clear for a disease, then the puppies are cleared by parentage in some of these diseases. But if you have that in that puppy, that doesn't mean you don't ever test that puppy again if they were going to go on to be bred. And so there's some diseases that through different breeds and through different pedigrees, if we rely completely on cleared by parentage, we can be wrong. We can have that disease crop back up again. So my recommendation, and many of people even on this call, I'm sure, is that if you are going to turn that animal into something that will be fed as it goes forward, do that test, even though they were cleared by parentage, because DNA changes, humans make errors with swabs, labs make errors, nothing is perfect when it comes to that. So please don't breed your dogs cleared by parentage if you have the opportunity to test them. Lots of companies, I don't endorse a certain one, so sorry if you wanted to have that answer tonight. There's a handful of them now. They've become really accessible. OFA does a lot of has a lot of testing labs and testing kits you can order for, I think, 30 different diseases as well. And really the diseases, I mean, EIC, CNM, PRA, glycogen storage disease is a curly thing. And then our degenerative myelopathies and our shepherds and our Chessies and some of our other Bernese mountain dogs and such like that. And so tons and tons of diseases when we delve into this realm. Typically, we're just going to do that one time in life. It's DNA, doesn't typically change. And most of the time, like I mentioned, EIC, you can do that when they're having their dew claws removed at 3 to 5 days, if you're still removing dew claws, but there's a different podcast about that. Search Shull dew claws. You'll know how I feel about such things. So, and some genetic tests, very black and white. EIC, very black and white. They either don't have copies of the gene, they have a copy of the gene, they have both copies of the gene. You know which dogs are going to be affected, which ones are never going to have a sign, for the most part. I mean, Mother Nature always can throw some curveballs. But then you've got all these other genetic tests that are like, well, you've got the gene, but you might not actually show it on the outside. And you have to see what happens. And there's genes with, looking at different colors, if you're a Merling breed, there's different things that are related to blindness. I mean, there's so many things that go into this DNA thing. Now that we know the canine genome, we can really delve deeper into it. Most of these tests can even be done by owners. These are test kits you can usually get. But if you are going to link these to most databases like the OFA, you're going to need a vet to say, I scanned your microchip. This is the dog you did it on. Here you go. So that at least we have some quality control the best we can on that. So that's all I was going to specifically say about genetic tests. And I was going to delve a little bit into how you'd even figure out which diseases to test for in your breed. And so as you look in the OFA website and you look under this CHIC program, you can browse by breed. And so what CHIC is it's each breed club has decided, and like I said, humans, right? So we're not all perfect. And we've all already discussed at the beginning, breed club drama is a thing. So not to say that breed clubs that decide on this list is the absolute thing that will never change, but at least it gives you some guidelines to go off of. So here's the one for Labradors. And so the breed club of Labradors recommends that if you have a Labrador, these are good tests to do. And so our hips, elbows, eyes, heart are, and you can see optional, but recommended. So we got, you're not far off, Pat, what you still remember from, before as far as health testing. This is what the Breed Club in 2025 would still agree with you to do too. So, hips, elbows, eyes are our big deals. No reason not to test for EIC, especially if you're going to consider breeding that animal, so you know which dams or sires to pair with. We certainly have a lot of conversations around the dilute gene and maybe trying to make sure that doesn't creep up on us in our breed. Our CNM, which luckily is a fairly disease of the past, but was certainly life-limiting for a lot of dogs. Our cardiac evaluation, and then our IPRA test. So just an example, not going to delve in deeper with that, but you can do this for any breed, simple clicks on the OFA site. And then there's like everything else. And so when you delve into the OFA site, you can OFA certify teeth, you can OFA certify thyroid test, you can OFA certify, depending on the breeds, spines, patellas, even some respiratory measurements in some of our brachycephalic dogs. And so there are databases. I'm not weighing in on if that's a good thing or a bad thing, but it's a thing. And I have to think that it's better than just putting our head in the sand, but it still can be hard with decision making. And so I put on here, I know that this is a genetic test, but I want to give you a little shout out to, we technically now have a test for Cruciate disease at University of Wisconsin for our labs in Newfoundland. It's a very valid test, but we don't even know how to use the results yet. It's so new. And so there's so many, this is such a changing landscape. And I can see how it'd be confusing for people day to day as they're going to get puppies, as they're making breeding decisions. I mean, it can be confusing to me, and I've had classes and such things. Any miscellaneous things you want to jump into, Pat, before I keep philosophizing?
Well, you covered a lot of that. I'm kind of eyeballing some of the questions, and we are going to get to them. And you talked about cranial cruciate ligament disease certification or testing, and that was a question that came in. The CHIC was a question. So you're covering a lot of folks' questions before I'm able to actually answer them. So
we all got together and chatted before tonight.
This thing all stemmed from a phone conversation I had with you while I was driving down the road when we just got talking about we originally talked about the your studies and what you wrote up in about the cranial cruciate ligament disease, and we went into this and we said, wow, we need to make this a class. Well, voila, we're doing it. Well, you're on a roll. Keep going.
So there's some tests. We've talked about that. So those are kind of the what's of what you can do. We've done some of the who's and whys. Now it's kind of the what you do with it and the thought process about this as an overall big picture, whether it's the tests we have today or it's the tests we have a year from now. Not all clearances and diseases are created equal. Like, a great point that you already brought up, Pat, hips versus elbows, even like those should, literally black and white, they're x-rays. And even they're not created equal. And so when you start delving into kidney diseases and bleeding diseases and, colors and, curly hairs versus knots, and so many things you can test for now, you really got to ask yourself, what's the impact to the dog? Are they going to die? Are they dying at 2? Are they dying, at 10 or 12, and that for your breed seems reasonable? Is it going to limit their career? Is it an elbow dysplasia where a field trial retriever and elbow dysplasia, obviously it can be done, but is that the right thing to do? What's the impact to the owner, right? Like, just because we can replace hips and elbows and such like that, does that mean that every puppy buyer should want to or be expected to, on top of all the rising costs of pet care in general? And is there an impact to the breed as a whole, right? So if you have a smaller breed where, in curlies, we have 2,000 in the US. If we let something go totally unchecked, we're going to have it in all of our dogs pretty quick. And so is there something within the breed that is going to drastically change the breed if we don't pay attention to it? is there an impact to the sport, right? Whatever your sport may be, if it's, lure coursing or the different field events and such. And then these are not apples to apples, breed to breed. And so if you have friends in other breeds and your priorities are this and their priorities and that doesn't mean you're each wrong. It's you're right for your breed. And even every point in time, based on popular sires and such, this stuff changes quick, right? Like dog lifespans, it's why dogs are studied so much from geneticists and the human side is they can study a disease and change a disease in just a couple decades, right? And they can look at interventions and such. I mean, it happens quick, and you can breed and make more litters and you can change it. And I mean, there's whole colonies of curly coated retrievers with glycogen storage disease that have changed that disease in kids in just a short time. I mean, just even in 12 to 15 years. And so dogs, this happens fast. And so what you might have done 20 years ago may be irrelevant, or maybe it was more important than ever in 2025. And so it's very dynamic, and it might not be the same in other countries. And so we're really talking about the US and dogs tonight, but it's huge as far as looking at the big picture. And what makes it even worse is not passing their clearances doesn't even mean it's going to affect the dog every day in their life. And so, some of our hip dogs, they might not limp a day in their life. There's this dog, I mean, he was, probably 14 when he died. And I accidentally found his hip dysplasia. Like I've taken an x-ray for something else and it's like, whoa, you have horrible hips. Never limped a day in his life, never would have known it any other way. And so, there's certain diseases that don't mean the dog even cares. And so as we're decision making, that makes it even harder. And so why wouldn't you do health clearances, right? Like there's expense to it. In the overall scheme of things, when it comes to entry fees, travel to events, buying the puppy in the first place and such, these costs aren't that bad. And I hate to say it because they might be, people have different opinions of me than that, but our field trials are $100 a pop these days, and running multiple dogs, multiple stakes and such like that. I could health test one of my dogs on a field trial weekend if I'm doing any versus doing any traveling. And so, but there's cost to test, especially if you're doing the whole litter and trying to be responsible before they go to their new homes. There's cost to list in the database. There's cost. And so it's an added cost of having dogs, which is an expense, but not as cost prohibitive as some type of procedures or such might be, and oftentimes cheaper than treating for those diseases. And so accessibility to tests and specialists, right? Like if you're in South Dakota, there's not board certified specialists in that state that you could even go to. So you're either gonna have to bring somebody in or travel, and it's much more access to care issues for sure. And it's a hassle. You got to fill out the paperwork. I mean, I just did my annual eye exams on my six, and I mean, the forms, I think I did it 3 weeks ago, and the forms are still sitting in my bag. I mean, I haven't sent them in. And so you got to put a stamp on things, and you got to send them in, and that's real world. Like Pat mentioned, sometimes they take weeks to get back. So, if your bitch is in season now and you didn't do her clearances, you might not be able to get these back in time to do the breeding and make your decisions and stuff. So you do have to plan ahead. And then all the gossip and vulnerability, like it sucks that people talk about this, and you're like, you don't want to know this, and you certainly don't want other people to know it. And it's a real thing. It's human nature. And so there are some reasons why not to. It's not all just yay health clearances. There's some other parts about it. And the more we know, the more challenging it is. You everything's lining up. You're good. You do one more optional test just because, and you get this equivocal something. And now what do? You've been planning for this breeding for years. You bought this dog to plan for this breeding in years. And now you've got this equivocal test, and it changes your whole world. And then to make it worse, it's not all about the health clearances, right? So we're talking about health clearances tonight, but when you're making all these decisions, you're making all these decisions based on everything, all these health clearances and all these things you can send in and go to specialists for, and everything's lining up and you're feeling great, but there's structure, there's temperament, there's performance, longevity, right? Like if I don't have if I can have every health clearance on the face of the planet, but if that field trial lab's not living past 6 or 7, right in their prime, as I've done all this and gone on this journey with them, what good is that? I mean, clear health clearances doesn't mean longevity. Trainability, right? Like, and I gotta shout out to all my Cosmo sired peeps. Got 3 of them, and by choice, young dogs. And so, noise, like, that's probably a bad thing, right? And there's no health clearance to check for that. But we're all ripping our hair out, and the dog might be too, as we make these decisions. And so, breed type, and then some of the non-testables. And so, all the things we can't even test for. And so, we've got seizures. And when we talk about prioritization, impact on dog, impact on owner, impact on life, impact on all these things. Golden retrievers and Bernese mountain dogs with their young cancers, bloat, right? How many of our retrievers, we can think of names and faces in the last year or two. And then even if they're perfect, we got to make more of them. And so some of these dogs have no fertility to go forward with. So that's not good, but we don't have a magic test for it. And so temperament, corporatism, hernias, and many, many more. So this isn't easy as far as a test. And so we don't have tests for these things, but always working on it. Thanks to everybody being involved with their breeds. Okay, Pat, I have just a couple more philosophical type things about health clearances. Anything you want to chime in about, or keep rolling?
Well, I mean, it's certainly struck home. You're right. You can have all the health clearances, but if your retriever doesn't like to retrieve, or has an adversity to water, or can't find, uh, it's behind with both hands, can't mark. I mean, you're not going to promote that. And I guess, and one of our discussions was, all right, when you get into prioritizing, and I don't know if you're going to get to deal breakers because we talked about that, but you're right. I mean, that there's some things that you just can't live with. But I don't know about you, but I've been around a lot of great dogs, and none of them were perfect.
Right. And neither are we, right? Like,
Right. So
and,
that is the hard
and
part.
and we're different from our siblings, thank goodness, right? And maybe our parents. Phew. And so, we can all relate to those things. So how we expect our dogs to be any different, is just, we're just wrong. But we get caught up in the emotionalness and the individuals, and we all love this. That's why we're here, certainly. And so, that's a good transition into, like, okay, and now you've done all these health clearances. This is the dog you want to breed. It checks all the boxes for you, for your sport or your life or your passion, whatnot. But now you do all the clearances and they make puppies, and they have bad things, right? And so you have all of these OFA, not passing OFA, but from OFA good parents. You have, I mean, take your pick. Rarely in the genetic diseases, that usually is human error if that happens. But in the hips, eyes, hearts, and hips, elbows, hearts, eyes, sorry, you can get them no matter how much diligence you've done. And so we do have to remember, at the end of the day, these are biological creatures. They're exposed to things in the uterus. They're exposed to things as puppies. They're totally things, some within our control, some without. And curly breeder that I just adored from decades ago, always called them genetic slot machines. And that always stuck with me because they are, right? You're literally you're doing everything in your power to stack the odds in your favor, but you're still rolling the dice. And in a lot of these situations, when you actually delve in, as I have people come to me and say, how did this happen? Like, I did everything and this happened. Well, a lot of times the siblings weren't even tested. And so, it's that whole, like, a pick of the litter of whatever is still whatever. I won't swear on a Purina MasterClass, but if everything is bad in a litter and you just happen to have the one good dog, well, guess what? Whether it's performance, whether it's health testing or anything, it's probably not going to produce the good. It's going to produce its sister. It's going to produce its brother. It's genetic. And so, that's just the reality of it all. And plus, even with all of that, you might have tested all the siblings, you might have done, all this. And I think this was one of the things on one of the pre-submitted questions was, maybe it was the environment. And I have a separate slide just on environmental considerations. You did everything right, and then you release it into the world, and the world wasn't right. And very few of these conditions really even have such simple genetics where you can say, do this, don't do this. Most of them are a collection of information that you're trying to make decisions on. And so, are my main environmental considerations that I would think about that can ruin perfect health condition or clearances. Obesity, hands down, scientifically proven. Don't let them be fat. Don't let them be fat from day one. If you let them be fat, you can take the best hips, generations after generations after generations, best knees, best a lot of things, and ruin your health clearances and everything anybody's gone before you to do. Don't let them be fat. Feed them right. And I did not just put that because of Purina. I really mean it, right? Like, we all know that nutrition plays a role in everybody's upbringing. And so why not optimize that when they're growing, or else you really can ruin everything you've done before. A lot more work, but a lot of even more controversy and gray areas come around the spay neuter thing, but potentially we're taking these dogs before skeletal maturity, considering spay and neuter, and that might be why we sometimes get some hip dysplasia or elbow dysplasia coming through when the parents were cleared. Exercising, overtraining them too early, right? These dogs, before their growth plates are closed, probably shouldn't be doing some of the things we're doing with them. And that may turn those perfect elbows into not perfect elbows. Now, there still takes a little predisposition, so I'm not going to write it all off on just these environmental considerations, but there's certainly plenty of situations where everything was good up until that moment, and now this dog was fat, overworked, poor nutrition, maybe spayed neutered, and it's still technically a predisposition, but it was the environment that did it in, and tons of others as we delve into that as well. And we got to share, right? So all this is only important, only useful if we share it. So as we delve in and look for results, somebody had to share them in the first place. And so make sure you submit those results to the OFA, including genetic tests. If you do tests on your dogs, share that back with your breeders. Many breeders keep producing things because we just didn't tell them. Like, we forgot to inform them when the dog was 5 that it had cruciate disease. That doesn't mean go after them. That doesn't mean accuse them of something, but just inform them. That information is powerful. Tell your puppy people, if the dogs are adults, that you saw something in the next litter. What if that's going to help change that dog's career or that life if they could have prevented something? I don't know if this applies to any of you, but it certainly applies to me. I know how I've judged others. I know that I've heard this, that so-and-so's dog didn't pass something, or don't you know that this line has that? When you judge others, it makes you really flinchy about sharing stuff, because you know how people might be judging you, because guess what? You did it. And I'll admit that 100%. It's hard. It's human nature. It's hard not to do when we're so wrapped up in this realm. It's difficult. The box on most OFA forms that say authorization to release abnormal results. And if you don't initial that, they will not release the abnormal results. And so, not to say you have to, but until we start doing more of that, we don't have the data that we fully need. And so, like I mentioned earlier, you can access all of these reports on the OFA website, disease statistics for every disease. I just pulled one up for advanced cardiac disease, and it has breeds based on how many percent's abnormals, and there's lots of fun stuff, and it's all up to date. So it's super accessible information by all of us. It's free, but it's only as powerful as us that put it in there. So with that, I have just a couple things, Pat. I wanted to just make my wrap up points, and then I'm all set. Anything that you want to interject before I hit on these points?
Well, I know we're going to have some questions coming in that they've been, and there's some good ones.
Okay.
It can be overwhelming. I mean, I'm sitting here going,
Extremely.
oh my God, you know, so I guess I encourage, you're not going to understand all of it, but educating yourself gradually, being aware of it, being transparent. And, it may be yourself that you're helping 10, 15 years from now uh, with a dog down the road. And but take it by baby steps, relook at some of this stuff, do your homework, and it's going to pay off.
So it was fun when I was putting these together because just randomly, this 8-week puppy picture that I have on this slide was the stacked picture of the curly bitch that I had on the first slide that went on to win our national specialty and was a master hunter, and all those kind. Her dad was a qualified all-age field trial curly and blah blah blah. So it was cool for me to see this, even the slide presentation of my own dogs truly come full circle, where here you're doing an 8-week puppy evaluation and doing all the health clearances and making all the decisions and and such like that, and you have no idea that jump ahead, this little puppy, you hope, is going to turn out to do bigger and better things, but you have no idea fully that you might get that call that she did such things out of the veterans class. So pretty cool. So here's my points in summary. And some of these might sound a little soapboxy, but they are. And so I hope many of you feel the same on these, but I just wanted to share mine kind of as a collection of my past experiences and my thoughts as I go forward that have some of which may have changed along the way. But at the end of the day, all this is personal. Like, you are the only ones that have to sleep with this decision. And so everybody makes decisions based on their past experiences, their knowledge base, their future outlook, and it really is your decision at the end of the day. So there's a lot of information out there, and I have a slide on resources that you'll go forth with so you can learn more and keep up with this. Especially with genetic tests, it's definitely been proven, don't throw the baby out with the bathwater. And so if you're not familiar with that genetic phrase, it's just the fact of, if we hyper focus on one disease, especially in our smaller breeds, we will throw away good genes too. And so whether it was EIC in our Labradors early on, there's a lot of carriers of a lot of diseases that don't affect the dog, the breed, the sport, the owner. And so as we start to hyper focus on one certain part of the dog, if we were to make a huge push across the breed and throw that baby out with that bathwater, more problems will occur. And oftentimes they're really ones we don't want to delve into. And so I'm not saying, don't eliminate certain diseases from certain breeds or certain breeding programs, but be real careful. I really hope you can hear my message about not hyper focusing on one thing with some of these breeds or a lot of these breeds. And you already heard me say and saw it on a slide, they're not just for dogs being bred. Really, please look at these siblings. A lot of other species, horses, cows, such like that, do a lot better job in this. Other countries, our Scandinavian countries kick our butts, especially in the retrievers and spaniels in this. They're not just looking at the one dog, they're looking at the other siblings that may not be being bred. Health clearances aren't the above all end all. You can have every health clearance in the book, but if that Labrador is going to eat me because I say no to it, maybe that dog shouldn't be bred. And so, that goes into that some dogs shouldn't be bred. If you're in a breed that has a lot of options and lots of dogs in this country, and you're finding that you have great health clearances, but there's all this other stuff that you have to improve on. Bottom line, as much as we love them and we want to make a whole bunch more of exactly what we love, some dogs shouldn't be bred. And I know that can be hard, and I've really struggled with that in the curlies because we don't have a lot of them, and I really have had some really exceptional ones that even other people would agree were exceptional, not just because they were mine, but there are some that just shouldn't be bred. And you're going to go forth and you may go to your veterinarian who knows nothing about these tests, about your breed. And so you may be the expert in the room, but that person did go to school for this stuff in general, and just try to work with them, even if, they don't know it that doesn't mean they can't help or won't help. A lot of them really do appreciate the fact that you're trying to do the best for your breed. And so working with them, helping to educate them, inviting them to your sport, inviting them to your nationals, inviting them to things, getting them involved, just like Pat did with me, right? Like I was a baby vet. I didn't know what a field trial was. I accidentally moved into Fenwick. Inviting me to a national is why in 2025 I'm doing this, right? So invite them, and you might have amazing allies for eventually half of your life path. Share information and stay up to date with resources. I think I mentioned a lot that, these things change. Form does follow function in a lot of these breeds. And so, we do have to realize that, some of these real athletic dogs need to be athletic and then, oh, by the way, get some health clearances as well. And so, this also comes from some of our other species like our horses and such, that it's not health clearances aren't the above all end all. And then we can do better, right? Like we can make it better than we are right now. And that's why we're doing this talk tonight. That's why we're trying to get some thought processes going. And it was fun for me to even make this presentation because this is something that I enjoyed chatting about, thinking about. I've had sleepless nights about everything on all of these slides, in my own personal decision making with my own dogs and breeds. And so it's hard. And like Pat said, it can be completely overwhelming, emotional. You're crushed when you get those results. You don't know where to do next. You're not sure who to even turn to. You don't want to tell too many people because that's scary and vulnerable as well. And then there's lots of resources. Orthopedic Foundation for Animals. I mean, I just can't say enough good things about this website. It's only improved as time goes on. You can search by breed. You can just delve in, and then it's got all these different, like, tell me more about elbow dysplasia, tell me more about eye disease, and then the CHIC information listed under OFA. Lots of good stuff with PennHip, your breed clubs. Your veterinarians involved in any kind of repro work typically are going to deal more with the repro or the purebred dogs. And so those are great resources typically to tap into. They do have some health clinics listed on the OFA website. Consider hosting them, right? If you're frustrated that they're not accessible, most of these places, they need a barn. They need a dark space to do eyes or listen to hearts and do echoes and such. So, I'm really proud of the field trial community, seeing this pop up more and more, where we're hosting health clinics and making these more accessible so more dogs can be tested, because it's only going to help everyone going forward, especially these dogs. And so I also included, of course, the ophthalmologist and the cardiology sites, because there's a lot of information about the diseases, and that's what I had. And so I thank you all. I thank Purina. I thank Pat. I thank everybody that came before me, everybody that I've mentored and such. It's been a really amazing career, and it's luckily now turned into everything I now spend my money on as well. So, and I'm not done yet. Way far from retirement if I have these dogs to pay for.
Sarah, thank you so much for everything you put into it. And I'm looking at this picture, and these dogs are day drinking. What's going on here?
So we were in Wisconsin. I also did HRC for a while with both these curlies, but 500 point dog on the right, and we just totally failed the grand. I mean, completely failed the HRC grand with a couple series. And so my friend Aubrey and I had a great time. And so this was, it can be titled either things you can do with force fetch or after you fail the grand. So this is one of my favorite pictures, 2 dogs.
Well, thank you once again. And, I guess one perspective I have is how quickly with these generations we can alter breeds. I mean, I've seen a dramatic transformation in the temperament of modern Labradors from 30 years ago. So by being aware of these things, you can truly make a difference. In humans, it would take a lot longer, wouldn't it? But in dogs,
Right.
you can change things in a hurry. And so, this is just great stuff. So uh, I loved your wrap up, and it put things in perspective. And we do have some of those questions, and I'm going to grab a couple, and I'm going to pop them up on the screen, and some of
Okay.
which you've already answered, and I'm not going to pop those up, but here's one. So you see this? Can you speak about Queen Anne's legs? Is that a form of elbow dysplasia? Question mark.
I don't even know. I've not heard that name actually. It's
Okay.
not a it's not a term of any forms of elbow dysplasia that I'm familiar with and any breeds I'm familiar with.
Okay. Well, I hadn't heard of it myself. Okay. I think you probably answered this one about prelims and the value of prelims. Um,
I don't
and
discourage anyone from doing prelims as far as if it seems to make sense in that moment where maybe you have the dog anesthetized for something else or sedated and why don't we just take a couple of, quick radiograph. But as you're making decisions, you really need to have that done after 2 years old as well. So as long as people aren't hanging their entire hat on prelims, they still can be very valuable. And I'm certainly have randomly done them on my dogs if I just happened to be in that situation, or we all just get curious, or maybe we had a bad experience with a certain disease. And so prelims have their place for sure.
so look at this one here, Sarah, from Stephen Potter. Can you read that?
Yeah. So distichiasis. So most ophthalmologists that I've chatted with, a occasional eyelash distichiasis. So distichiasis is an extra eyelash for anyone that isn't familiar with the term. And so if you had a bunch of those and they were affecting the dog, they can be extremely, I won't say life limiting, but certainly career limiting, annoying. They can have all sorts of issues with ulcers. You certainly wouldn't want your dog out in the field or anybody, right? Like we all know what it's like to have an eyelash in our eye. It sucks. And so if you had an eyelash in your eye poking your eye every day of your life, bad, right? But there's certain extra eyelashes that are picked up on an eye exam when ophthalmologists do the eye screening, where they'll make a note of like one eyelash that is just extra, but it's not actually rubbing on the eyelid or eyeball. So that's one that's you got to take in context. So one extra eyelash or a couple extra eyelashes that point out in most breeds versus a whole bunch of eyelashes that are pointing in and making contact with the eyeball, that's a different decision making. So even it's not even black and white when we're talking about extra eyelashes. That's how confusing this decision making is.
All right. Susan asks, are they any closer to making a determination of mode of inheritance for TVD and Labradors?
I don't know if we're any closer. I think I don't, I don't know who specifically is running that collection of information right now. I think we're still way off from having enough samples. So that's an encouragement to do as many as you possibly can as far as get as many dogs into a system. But I don't know who's spearheading it right now. If someone knows that, let me know. But there should be a lab somewhere in the country that is collecting that, but I don't know who it is. So I'm going to say no, other than it is, and that's one of the fatal diseases, right? That's one of the drop dead at 2 years old, and certainly we have it in the breed, at least in Labradors and field trials, in field trial pedigrees. Sorry, and so we're seeing it come up, of course, in hunt test Labradors and such like that as well. Pretty bad disease. That's one we should probably do something about. But we need more people doing health testing, including echoes, to actually screen their dogs, because unfortunately, a lot of those dogs don't even have a murmur to follow through on. So you may think everything's fine, the dog's running great, never acts sick a day in its life, and then drops dead. And on necropsy or autopsy, you find that disease. So that's one of the diseases that I would consider a little bit of an urgent disease in our breed/sport. So that didn't really answer your question, but I'm glad it's on your radar. But I saw one
Excellent.
pop up about
Yeah. I'm sorry. I've jumped the gun
yeah,
a
no,
little bit.
it's a good question. And so if they didn't pass and the dog's a special dog, does it ever make sense to retake them and submit a second time? If there is secondary changes, so if there is actual arthritis that is, we're assuming proper positioning. If we don't proper position, retaking them is valid. Or if they were taken without sedation, maybe try to do with them sedation. But if there's secondary changes, there's bony changes around those joints, hips or elbows, retaking them, chances are won't change it. Now, that being said, there are some dogs that in certain breeds that don't pass hips specifically that are still bred because they are a special dog. And that can be okay in that breed and that line as well. So it's not so much the should you retake them or not, it's the what breed are you in? What's the prevalence of that disease? What other stuff does this dog check the boxes of? I really struggle with making decisions about elbow snap passing just because I've seen such in my sport, in my breeds, elbow dysplasia is so bad that I have a hard time justifying that in a breed that has, their dime a dozen every street corner. Because I mean, I don't want to say how special can they be. Obviously, we have some pretty amazing animals, but you have to really think a lot about should you go forward with that.
Okay. New genetic test for golden HCM at NC State. Dogs were dying by 1 and 2 years old.
Yeah, bad stuff. And that's a really hard one too, because, we were also all caught up with, was it grain free? Was it a certain thing in diets? Was it this? Was it, and everything? And poor Goldens, they get all the things. And so, that there'd be lines that were cancer free and were living till 12 to 14 and everything was going great. And then, oh, this heart thing popped up. And so it's bad, right? And so if we're not screening within breeds for things like cardiac stuff, once again, they're biological creatures. Genes and heredity evolves and changes, and we can have some pretty bad diseases crop up. So I don't know
Not
anything
everybody knows what
specific.
HCM is, so why
Oh,
don't you just...
sorry. So hypertrophic cardiomyopathy. So a heart, when it enlarges, can either enlarge to the inside or enlarge to the outside. And so you can either get big stretched out hearts like like some of the concerns we had for, the grain frees and the Dobermans and the boxers and some of our breeds. And then you can have the hypertrophic ones. So if you take just an x-ray, it looks like a normal sized heart, but when you look inside the heart, it's all filled in on the inside. And so this is a common condition in cats as well. And so there's some concerns about, is it a taurine deficiency where nutrition wasn't quite right, or the dog was predisposed to it genetically? And then, I mean, and that probably was, one or two dogs that had an issue, and people getting together going like, wait, my dog had an issue too. This isn't right. Let's test it. Let's follow up. And so, the Goldens have had a couple of those diseases in these last 5 to 10 years where, thank goodness for the internet and social media and such like that, where people can go like, wait a minute, my dog had that too. And that's not right. And then go forward.
Well, that was a good segue into this question, because please address taurine testing in relation to concern of nutrition.
Well, with proper commercially available dog food, you should not have to worry about that. And so the breeds or individuals that we're seeing that are taurine deficient, the most up to date, at least I am about this. There might be certain breeds that I'm not following along in. They shouldn't need additional taurine. And so if you're finding that they do in a breed or a line or something like that, then there is a problem as far as a predisposition for needing more. And so, yes, it's become more and more of a thing that we've uncovered with the scare about all the grain frees. And it just goes back to the importance of, sharing information and, considering nutrition as a crucial part of things.
Oh, Nancy asked, would an oscillation
Yeah,
be
sure.
sufficient and an echo if abnormally found,
Yeah.
or do you recommend both?
Yeah, Nancy, for curlies, we got to do more echoes, and we got to do more echoes long term. Like we can't stop. And so kind of the decision making with echoes are, do you do them just the one time and look for the congenital disease, or do you go through their lifespan and look for those acquired diseases? And Curlies, we do have some acquired diseases where some of those mitral valve diseases and some of our other ones don't show up if you echo them at 2. And so, by the time they're 5, 6, you might have bred that animal, made great puppies. Nancy's got some nice curlies, by the way. Uh, but if you don't continuously test, and I don't mean you have to for every single dog every single year, but certainly before you're going to be bred, certainly spot checking them through a lifetime. It's not just good for the dog, but it's going to catch up on some things. And we definitely, the curlies, curlies get just about every retriever disease. And so we get a little bit of the tricuspid disease and a little bit of stenosis and a little bit of this. And so we usually don't have just one disease in our breed at any given time. And so we do have to be diligent. And that was something that I think I could have even improved on with my curlies, would be more heart testing. I was very diligent about the rest of the stuff, but even more heart testing, I think, would have been valuable.
So I think you commented on PennHip versus OFA earlier, and
I think they should be used together. I very much, in my perfect world and all the breeds that I personally delve into, I would like to do OFA on everybody, and then I would PennHip in and out. Like I would spot check with PennHip basically, or if I had an animal I was trying to decision make early with, I would PennHip that animal. So like if I needed to know at 16 weeks for some reason, most of the time, if I'm doing PennHip on any of my personal dogs, I'm waiting till they're 2 and doing OFA and PennHip at the same time so I can get both images.
great. Here's one from John Dunn. Are all types of retinal folds disqualifying for
I don't
CADF?
know. I'd have to look back on the OFA website. They're actually on the OFA website. If you look under eye diseases or browsed by disease and then eyes, it actually lists all the different diseases. It has a whole glossary of diseases, which ones are breeder option as far as like which ones are okay to continue to breed. It's actually a fabulous website. So I don't know if all retinal folds are right this second in this world.
Okay, here's one. Any test for GOLPP? What
So
is GOLPP?
Yeah, so GLPP, Pat, you would have been most familiar with the LP in it. So these are our laryngeal paralysis dogs. We've now retermed the disease, and this might hit home for you. So what we used to always just call laryngeal paralysis dogs, LARPAR dogs, where the dogs that have the trouble breathing down in their throat and they're having trouble moving air. Most of our Labradors, they actually have trouble finding non-LARPAR dogs once they get over 10. We've now termed this and classified this as a big condition. So it's geriatric onset, so GO, laryngeal paralysis, and polyneuropathy. So a lot of these dogs are old, they have LARPAR, and they're weak in the rear, and the weak in the rear progresses. So we've now figured out that this is a neurologic disease. And so it's actually, even though it seems weird that their back legs weakness and their throat are the same, it's actually the same. It's a progressive neurologic disease. And so it's gulp or gulp dogs. And so I'm trying to think, I think there's a breed that was close to it. Dr. Stanley did a ton of work at Michigan State characterizing the disease and doing a lot of testing on it, but I don't think we have an absolute test that is like something you could send in that says, do they have gulp or not? She did a lot of the characterization of like that not all dogs show the same symptoms, even though it's the same disease, and what their outcomes might look like long term. But I don't think University of Wisconsin was the last I knew. So you could look on their website and see where they're at with their gulp test. They came out with the cruciate disease test, and I think they were collecting information and samples last I saw for gulp in at least Labradors, but it does happen in most of our breeds as well.
I lost one of the nicest Labradors I ever worked with was in his prime, and that afflicted him and ended his career and his life.
Yep. Yep.
Okay, let's see what we got here. All right. Well, you talked about this a little bit. You mentioned a podcast on dew claw removal. I'm interested in viewing it.
So seriously, if you Google search, hopefully you don't find anything else strange, but if you Google search Sarah Shull, dew claws. I did a podcast in 2020 or 2021 with Bird Dog Babe, who actually, Courtney was who I got my wire hair pointer from. It's featured in some of the slides, and those excellent hips actually on the hip slide. She talked me into doing a podcast early on. I was her podcast number 2. Lauren Hayes actually was her podcast number 1. So darn it. But it was also a great episode if anyone's interested. So Bird Dog Babe, Sarah Shull, Dew Claws. It's an hour of me droning on about all the discussion. So it's the pluses, it's the minuses, it's the everything. I work with a lot of, like in the curlies, for example, I work with a lot of dogs overseas. And so like for my curlies, I didn't remove dew claws because we were importing, exporting quite a bit. So I didn't remove them with my dogs. My field trial retrievers, if they come without their dew claws on, I certainly am not judgmental or anything like that. I'm pretty neutral on this whole topic, but you can hear me discuss why I'm neutral as far as we do not know enough to be casting stones and such on this topic, in my opinion. And some of the really big sporting kennels, like our sled dog kennels, Nature's Kennels in the UP, I mean, that's a phenomenal athletic sled dog kennel, and all those dew claws are off.
Oh, wow. Okay, go ahead. Here, let me
Oh
keep
yeah,
this one on. Hold on,
we
I'll
got a good
pop it
one.
up.
So
Go ahead.
yeah, cryptorchidism, absolutely genetic, and testicles should be in the sacs by 8 weeks old. So all of our dogs that were like, well, maybe it'll come down by 4 months, and then they come down by 4 months, and then we breed them, or they don't come down, or they're delayed to come down, and then we breed their sister. Yes, it's genetic, 100%. That's not my opinion. That's just the thing. Now, that being said, I'm going to say it's 100% yes, it's genetic, but I'm not going to tell you don't ever breed that dog of that breed or its sister or anything like that, because that is one of those things where we're like, should we, should not, there's a bad tooth, there's a cryptorchism, there's a this. Got to decide, is it, impact to the dog, impact to the owner, impact to the breed, impact to the sport, in my opinion, as far as cryptorchism. But yes, definitely genetic, and those testicles should be down by 8 weeks. And I've been in that situation where I've been counseling clients and like, maybe it'll come down. Like, let's keep checking. Like, don't let your hands be cold. Check it again, and then they finally come down. And I hope we have another question after this, Pat. Don't make me end on that.
No,
Like,
no, no.
I don't
Uh,
want this recording to have that be the last thing I say.
the cold hands thing. Yeah, that's not
Yes,
good.
please
All right.
don't.
So Valerie, yes, Valerie, this is going to be recorded. So that's good stuff. Uh, all right. Hold on a minute. Brian says, well, you talked about this. Are dogs that are vocal a product of vocal parents, genetic or environmental experiences? Wow. Uh,
So,
our
so,
training group seems to struggle with dogs that are vocal.
so, so, so Brian, I literally meet with individuals every 2 weeks by Zoom for a support group for noise. Because yes, any trainer, and Pat, correct me if I'm wrong,
Right.
noise is certainly also a product of the handler, the environment, the training, the previous exposure, everything like that. Noise is genetic. And I literally right now in this kitchen have 2 Cosmo sons, a Mickey son, an NFC Mickey son, a prize daughter. Like, yes. Now, did I not buy those dogs? No, I bought 2. Um,
That-
so do I regret that decision someday? Yes, very much so. And would I um want someone else to do that as what I've lived in this last 2 years? No, like you shouldn't have to necessarily have support groups while you train your field trial retrievers. But not to say I wouldn't do it again. He has excellent hips, by the way. EIC clear. So, you know,
Whining Anonymous. So that's your
right.
group, huh? Barking
So
Anonymous.
I've met some amazing people because my dogs are noisy.
Yep.
Is it fair to me? Is it fair to the dog? Is it fair to my training partners? Maybe not. But I do think we all think that it is noise. Oh, good. And then the
Oh,
retriever
Kevin,
coach
it's great to,
comes on.
yeah,
Yeah.
Kevin, it's great seeing you. Seeing
I'm
several
glad I said
dogs.
this thing about noise.
Yeah, seeing
I'm glad
several
I
dogs'
didn't.
OFA hip results come back with
Yeah.
noted transitional vertebrae. How do you feel about this? Hold on, let me get it back up. When evaluating potential breeding dogs.
So, so interesting segue. So the retriever coach actually started some of the noise support groups. I saw that pop up in the chat. And I'm really glad that I didn't say that I thought noise was the best thing ever, knowing that Kevin was going to pop in. But yeah, so transitional vertebrae. So anybody that's not familiar with those, it's basically different sections of the spine. So there's the thorax over the chest, the lumbar over the lower back, and then the sacrum, which is over the base of the tail. Those are all supposed to look different than each other. Thorax are supposed to look like thorax, lumbar like lumbar, sacral like sacral. You'll have these little vertebrae that'll decide to kind of, when their dog's forming, that they kind of want to look like both things. And so you'll have these vertebrae that might look like a little bit like a thorax and a little bit like a lumbar, a little bit like a lumbar and a little bit like a sacrum. OFA, when you send your OFA hips in, will say a transitional vertebrae noted at whatever space. And in general, at least when I looked at it the other day, OFA is still saying that that's a breedable, like kind of no big deal. But if left gone completely unchecked, look at French bulldogs and some of our other spine breeds that are severely affected by vertebral malformations. I don't think we should totally let that go unchecked, because there are some breeds, especially like our tailless breeds that already might have problems with the end of their spinal cord. It is a vertebral malformation. Like, it is not normal by any means, but it's considered an incidental finding. So if you saw one of those once in a while, and this goes back to test all those siblings, maybe that one that you're testing that shows up one transitional vertebrae is just one, and all the siblings clear, and you're probably good to go forward. Maybe that one is the lowest number of anybody in the litter, and the rest of the litter has 3 to 5 of them, or other deformations or something like that. And so that's a great question, looking at the overall big picture when we're decision making, because your one might be the worst or the best of that genetic contribution to the next generation. And so at least in Labradors, OFA still supports breeding those animals.
Well, I'm going to give you a couple shout outs so you can. There you go. Thank you for taking
Yay.
time. And Susan says, much thanks to both of us. How about that?
Thanks. Mm-hmm.
We love an attaboy.
Yep. We knew
Oh, and
we'd
we
have a
got
good
somebody.
time. Yeah.
Somebody wants to join your support group. I don't know.
We
Is
kind
it a
of formed
secret
one on.
handshake?
We did. It was kind of funny because it was after one of Kevin's discussions with Randy Bone, actually, and there was a couple of us that, like, I got reached out and it was like, hey, you want to do this together? Because I mean, you really do need to do it together. And these two ladies that I'm with, I've never met in person, might never cross paths with them. We're all over the US, but we talk this through. We set goals. And a lot of it is the frustration of noise, which also our dogs have got to be feeling as well. But our dogs don't have support groups to talk about it.
Well, great. Well, you got a bunch of good shout outs there. I'm going to pop them through there. And I'm going to I'm going to wind this bad boy down, Robin. I promise not to not to dwell on that, but there you go. The replay will be emailed along with Dr. Shull's slides within 48 hours. Is that a promise, Rob?
Mm-hmm.
I guess we're going to have to stay up. Sarah, I want to thank you so much. It's great having you. It's great hanging out. It brings back lots of great memories. And boy, if one invite to a national had this trickle down effect, then makes me smile. It makes me smile to see you. And we've had lots of great memories, and I'm excited to see all you're doing in the world of field trials, and all you're doing for all of us along the way. So with that being said, I'm going to say good night to everybody, including you, Sarah. Thank you again. Thank you, Purina. And thank you, everybody at home, for being a big part of this. And well, we're going to go. Thanks, Purina. Good night, everybody. Bye bye.